Each year, WorkSafeBC accepts hundreds of claims from healthcare workers who have been injured on the job due to violent acts, and that causes a ripple effect throughout the entire healthcare system. More after this. It's not unusual for healthcare workers to be pinched, yelled at, spit on, sexually harassed, and even threatened with weapons by patients and their families. And the impact of these events extends well beyond the workplace.
We had a female resident. She was a bit aggressive, and we were doing care on her, and another care aide came in, and I think that set her off. I was standing, so when her mouth turned, it bit my breast.
I went in to assist one patient, and he was, an elderly patient with Alzheimer's, and he grabbed my arm, and I was a very new nurse, and I really wasn't sure of the protocols or policies, nor had I even heard throughout my training that any kind of aggression was even possible.
I went to a brand new client. He basically was talking to us and said he he couldn't take it anymore, and he was going to go get his gun.
These incidents are obviously disturbing for the healthcare workers, but they can also have a lasting impact on their families and their co-workers and the healthcare system as a whole.
It tires you out. So your sick time will get higher, because then it makes you afraid to be with certain residents. That fear factor is there, so you don't want to be alone, and so you might not give that person the care that the person needs properly.
People have to remember that the workers are the same as anybody else, that they're doing this because they love the work, they want to help, but if they're injured, it affects their ability to provide care down the road. But they often have families that are relying on their ability to provide care, and their ability just to be there, to be kind of a wife and a parent as well. When you have a serious injury, that really has some ripple impacts all the way along. So we really want to keep our workers safe.
When you or someone you love is sick and vulnerable, it can be pretty overwhelming. It can take over your whole life, and that's when we need healthcare workers the most. But we can't take that care for granted. We each need to do our part to create an environment where the healthcare worker gets what they want and what they deserve: respect and safety in the workplace. For WorkSafeBC, I'm Maria LaRose.